Before we get started, let me tell you a little bit about Compass Go. Compass Go is a mental health support team that works with children, young people, families and education settings across North East Lincolnshire to help promote mental health and provide interventions, support and advice to all different people across the county. Our team is made up of a variety of practitioners from all different backgrounds, so collectively Compass Go has a vast knowledge base and it means we can provide the best intervention possible to the young people in the area. Our work with education staff includes providing advice and support to help them promote mental health and emotional wellbeing within their settings, and also to help upskill them so they can provide some very basic information and interventions to young people so that young people are getting the best support at all times. When supporting young people, we deliver one-to-one interventions, group interventions and workshops and assemblies depending on what the young person needs at that specific time. If you'd like to find more information about what Compass Go can do and how we can help you, then please do visit the link on the screen. So as a service, we offer 2 levels of training. Level 1, which you should have already done, is designed to empower all education staff to feel more upskilled and more knowledgeable around some very basic mental health awareness and emotional wellbeing concerns. It was designed to help build skills and develop knowledge so that you as education staff feel more confident to deliver interventions and support young people in your care. Therefore, it enables education staff to improve and strengthen the support that young people get from them directly. This training, the level 2, is a bit more of a deep dive into mental health difficulties, and we provide some more key skills from a cognitive behavioural therapy approach. It's been designed for those staff who wish to further enhance their knowledge so that they can improve their daily practice when working with young people and families. It's not just about furthering knowledge, it's about acquiring skills and learning how to assess needs on a very basic level so that you can acquire more evidence-based tools to implement into the work that you do daily. Now, if you have not done so already, we would be very grateful if you could complete the pre-session questionnaire. Now, you only need to do one of these for the entire webinar series. There is a post-session questionnaire as well, which will need to be done at the end of each webinar, but we'll explain more about that once we come to the end of the webinar. The pre-session one helps us to understand your current knowledge and where you're currently at before you complete the webinar series, and we only need you to do one. So if you've already done it, fantastic, we can move on. But if you haven't done so, take some time now just to quickly complete that. It should only take you a couple of minutes. The training series is made up of 5 individual webinars, each one designed in order so that they follow on from each other. However, you are able to dip in and out of them as needed. So if something crops up, feel free to pause the webinar, come back to it at a later date, or if you've only got 10 minutes, try webinar 3. It's a 10-minute webinar in its own right. But we would advise you to try and do them in order as possible so the information flows and so it makes more sense. We've designed a workbook to go alongside this webinar series so that you have something that you can use to further enhance all your knowledge and understanding as we go along. But also it contains key information so that you don't have to worry about taking notes throughout the whole webinar series and miss bits of information as the practitioners talk. We've done the hard work for you. But it also contains note pages so that you've got it all in one place and you can scribble down some extra bits of information if you want to from the slides or from what the practitioners are talking about. But also as we go through the webinar, you will be asked to complete activities. Now the activities are in the workbooks, therefore you need the workbook in order to be able to complete the activity. We would encourage you to complete the activities as you go along. It'll help solidify any knowledge and understanding, and also means that you have the most up-to-date information because some of them are fill-in-the-blank activities and we haven't given you the answers in the booklet. The most important thing to remember when you're completing this webinar series is to look after yourself. Mental health is a very emotive topic because it affects all of us in different ways and we can't predict how it's going to impact different people who are watching the webinar series. Now everything's been designed to be delivered in a sensitive way and to hopefully not evoke any emotions, but just be careful in case it does. Now what we'd advise is that you identify someone now who you can talk to if you need them as you're going through the webinar or if you need a debrief afterwards. So have a think about who that might be and make a note, let them know, and once you're ready, let's get started.
When considering mental health problems, a good place to start when assessing a child or young person is by considering Maslow's hierarchy of needs. Maslow's hierarchy of needs is a motivational theory in psychology comprising a 5-tier model of human needs. Needs lower down the hierarchy must be satisfied before individuals can attend to needs higher up. The bottom 2 tiers are classed as basic needs and are physiological needs such as food, water, warmth and rest. The second tier is safety. and this includes security. The next two tiers are psychological needs. Belongingness and love includes friendship and relationships. Esteem needs to include a feeling of accomplishment. The top tier is self-fulfillment need and is self-actualization and the ability to achieve one's full potential. Using this model gives a basic review of their position and current situation along with the links to behaviour and motivation to change before delving deeper. For example, working on self-esteem may not be effective if the child or young person's safety or physiological needs are not being met. These needs must be addressed first to get the child or young person to a point where you can get them to work on their self-esteem. The 5 Ps is a type of framework utilising 5 factors which helps to conceptualise the young person's problem or need. So we have presenting issues. So what are the signs, symptoms or changes? Consider the young person's emotions, thoughts, feelings and behaviours, and that includes both the past and present. Precipitating factors. What are the young person's triggers? Think about internal and external factors that occur just before the emotional difficulty. Predisposing factors. What are the risk factors that make the young person more vulnerable? What factors predispose them to potentially suffering with a difficulty in their mental health? Perpetuating factors. What internal and external factors maintain the problem for the young person? Why won't the difficulty go away by itself? And then protective factors. What are the young person's strengths and personal qualities? What factors keep the young person safe and hopeful? This framework will help you to clarify what the current situation is, what you can do in the first instance, address any risk, and will support referrals onto other agencies if needed. So we're going to have a quick look at a case study now. So Harry is an 11-year-old boy who you teach at school. He lives with his aunt, uncle and cousin, but you are aware that he does not get along with them. His parents were involved in a fatal accident when he was just 1 year old, so was privately fostered by his aunt and uncle. Harry enjoys school, but you notice that he turns up in tattered and unwashed clothes that do not fit him properly, and the lunchtime staff provide him with additional food to supplement his lunch. When you ask Harry about his home life, he tells you that he spends most of his time in his own room, which is like a cupboard, but it's his own space, whilst his family spend time eating, entertaining friends, and going on days out without him. He was recently told you he has an interest in magic, but his family laugh at him and tell him not to be stupid when he brings it up with them. You've noticed over the last 2 weeks that he seems very flat and down in himself and doesn't spend much time playing with his peers. After speaking with other members of staff, you have concerns about his overall well-being. Pause the webinar and reread the case study in your booklet on page 28. Take some time to fill in the blank 5 Ps formulation for Harry and think about where he fits on the Maslow's hierarchy of needs. It might be worth thinking about whether there is anyone else that you would like to speak to in more depth to gain more information. Using Maslow's hierarchy of need, we can see that Harry is only just having his physiological needs met. His family do provide him with some food, water, shelter and clothing, but it's not to an adequate standard, and he's being supplemented at school. He cannot have safety and security until he's fully within the physiological level. So let's have a look at the 5 Ps and we can get a bit more of an idea of what's going on for Harry. So the presenting issue. Harry has become withdrawn from socialisation and is feeling very sad. Harry's not getting the care and affection needed at home to help lift his low mood. Precipitating factors. Harry's mood dips when his family laugh at his recent interest in magic. He does not like to socialise with friends and his mood dips during socialisation times. Predisposing factors. Harry's parents died when he was 1 year old. Harry's aunt and uncle do not show him affection and his nutrition is not adequate. Perpetuating factors. Harry's home environment does not make him feel safe and his clothing and food does not benefit his self-esteem. Protective factors. Harry has an interest in magic which gives him excitement. He enjoys school and finds this a respite from being at home. So let's have a look at where to get the information from. So the young person themselves. This is important as often children and young people are highlighted for having problems that they themselves do not consider as an issue. Children and young people are more likely to answer honestly if you ask open questions. Remember to adapt your questions to the age and understanding of the child and young person. It is important to consider not only what they are saying, but how they are saying it. Observation. When observing a child or young person, it's important to look for changes which are above the expected normal development stages. For example, a teenager who is normally concerned about their appearance suddenly stops looking after themselves, such as making the normal effort on their hair and makeup. When considering this, it's useful to take into consideration the duration, severity, impact, complexity, context, goals, and motivation, and others involved. Adults involved. This can include staff, external agencies, and parents or carers. Consult with others involved with the child or young person to ascertain whether they too have noticed any changes in behaviour, past or present, which has led to concerns. If external agencies are working with the child or young person, find out what they're currently working on, as it is important not to conflict with current interventions. So, have you got the full picture? So when we put all the information together, it builds a better picture. So to present an issue, we need to look at what is the current problem. Some common mental health problems, such as eating disorders, should always be assessed by specialist services. Duration. How long has it been going on for? A person can be low for a few days and then bounce back. Think back to your webinar 2 training. Depression must have symptoms present for at least 2 weeks. Severity. There is a difference between being uncomfortable and very anxious. Is this mild to moderate, or does it require a higher level of intervention? Impact. Are the problems affecting school, friendships, hobbies, or family life? Context. Some behaviours are normal reactions to certain situations. For example, low mood following bereavement or anxiety around exam times. Though it is important to remember the context in relation to the other aspects we consider when identifying a level of need. For example, a child may be anxious about exams, which is normal for the context, but other factors also need to be considered, such as the impact, as it may be that they've had poor sleep for weeks and not eating. Previous intervention. If things are not changing despite input, then they may need more specialist intervention. It is important to gather and share as much information as possible right from the beginning of involvement. Goals and motivation. Interventions can be hard, and a child or young person has to have a reason to change. We've already looked at the cycle of change in the previous webinar. Who else is involved? It's not helpful for a child or young person to have too many people intervening at one time. If a child or young person has been referred to or is seeing a specialist practitioner, then it may not be appropriate for you to also deliver interventions on the same presenting need, or to refer into another service for the same help. So, making referrals. All this information that forms your basic assessment is crucial to add to any referrals made to other services. Not only does it allow for more comprehensive understanding of the presenting problems, it also means that the young person does not have to repeat themselves as much during difficult conversations. As an external service, having a school's basic assessment means that a fully rounded view of the situation is gathered and a decision can be made with a greater ease about appropriate support.